On this episode of Splice Site, I talk with Rhonda Rowland, former medical correspondent for CNN, about her film, The Story of Wilson Disease. I'm your host, Daniel DeFabio. I'm excited today to have one of the filmmakers we met through our festival, Rhonda Rowland, and she has made the film, The Story of Wilson's Disease. So here is Rhonda. Hi, thanks for being on Splice Site.
Oh, I'm thrilled to be here. Thank you for asking me.
So let's start with, what is Wilson disease?
So it's a liver disease. And so what it means is those of us with Wilson disease cannot metabolize dietary copper. So what happens over time is the copper builds up and it poisons us. So it deposits first in the liver, and then when it's kind of reached capacity, it can deposit in other parts of the body, such as the brain and also the eyes.
Unlike a lot of the rare diseases out there, this one has a treatment. There's at least maybe 3 drugs that can help people with Wilson. So you yourself have Wilson, and you've been able to live a productive life, and I'm sure it hasn't been without its challenges. So just tell us a little bit about when you were diagnosed, what symptoms have affected you, and what the various outcomes are for others with or without the drugs.
Well, I was really fortunate. I consider myself one of the lucky ones. I was diagnosed in college at the age of 21, and that's kind of an average time of diagnosis. And what can really link it to is it took 21 years of my life for the copper to build up in my body and actually cause symptoms. And I often say that my symptoms were insidious. They developed very slowly over time. So I really didn't even notice them. But I was diagnosed with advanced liver disease. I was in liver failure. And the final tipping point for me was that I woke up one morning and my skin was yellow, the whites of my eyes were yellow, I was jaundiced.
And once you have the diagnosis, I assume you're prescribed one of these medications, and then it helps a lot, a little, or how does it start to remedy the situation for you?
Well, when I did have that day, it was on a football weekend, I remember. My friends they encouraged me to go see a doctor. And at that point, I was getting a little scared. So they actually drove me to the emergency room. So I remember I walked myself in, and the woman who was at the desk, she just looked at me and she said, "We need to admit you." And they kept me there for 5 days doing a number of tests. And at the end of it, they could not find the cause. And this is very common. The diagnosis is missed. And they said I had chronic active hepatitis, and they put me on steroids. And they suggested that I should leave school and go home. And they didn't know how long I would live, is what they had said. And at the time I thought, well, I don't feel that bad. So I went down to part-time and continued going to school. And about a month later, my doctor called me back, and he had me do an eye exam. And they found the telltale copper rings, Kaiser Fleischer rings in my eyes. And they're not actually copper colored, but the copper deposits is kind of a grayish, greenish kind of color. But that's how they made the diagnosis. And so then they knew what the cause of my liver failure was. And during that month, I presume that the steroids just kind of helped my liver, hang on. There are a lot of people who reach that point and have to perhaps face a liver transplant. But once they had the diagnosis, they said, "We have a treatment for you, and it's penicillamine, and it works for most patients. And if you take this every day for the rest of your life, you should be fine." And so I did start taking this drug, and it worked for me. And I started feeling better. And I would look back, and, a month would pass, and I would think to myself, wow, I haven't felt this good in years. And another month would go by, and I would think to myself, oh, I haven't felt this good in a lot of years. And that's how I knew it was just very insidious, the development of the disease. So over the course of some months, I just returned to what I would say is normal for me. And the doctors did tell me if by chance this drug did not work, there was a second drug called trientine that at the time was still in clinical trials, but I would probably be able to take that drug. And then since that time, a third drug was proven to be effective, and that is zinc, just zinc supplements that you see in the pharmacy. And about 15 years ago, I switched from penicillamine to zinc, and I've done just fine on that drug as well.
It's amazing. It sounds so simple once you know what the answer is. And the little I understand of this is that all three of these are sort of binding or absorbing copper so that you don't have the excess of copper in your system.
That's correct. Well, the first two, penicillamine and trientine, they're what we called chelating agents. And so what they do is they go through the body and they search out the copper and they bind with it, and then it's removed through urination. Now, the way zinc works, it's a little bit different. It goes after the copper that's in the intestinal tract. And so it's just a different mechanism of action. And typically zinc works best once most of the copper is removed, because those chelating agents are more effective at removing copper faster than zinc, but you still get that copper removal with the zinc as well.
Great. So you ended up having a great career as a medical reporter for CNN, right? And how did that, I'm sure that experience positioned you very well to go out and make a film on any medical topic of your choice. And of course, Wilson disease was one that was important to you. How did the broadcast journalist training prepare you or shape your film?
So the way I approached the story of Wilson disease was the exact same way I approached it for one of my CNN medical reports, or a report that I would do for WebMD or for any other client. So there is no question that without that background, I wouldn't have the wherewithal to have produced and reported the story of Wilson disease.
Great. And if you were to give advice to someone with less, a lot of people come to us with no experience, and they have a rare disease story they want to tell, and they're somewhat intimidated by filmmaking. So what sort of tips or do's and don'ts might you share with people to make their films?
Well, I did produce this. Basically, I was the production company, which that's something that I had not ever done before. And along the course of my research, I discovered that the doctor, Dr. John Walsh, who discovered the treatment that saved my life, and he discovered it back in the 1950s, that he's 98 and he's living in Cambridge, England. So I thought, I have to go and meet him. I need to talk to him. I need to thank him for saving my life. And one of my CNN colleagues, she said, well, I'll go along with you. And, we are TV girls. So, you should really hire a camera crew. So I did some research and found a videographer who also was an editor and a producer. So he kind of a one-man band in Cambridge, England, and hired him. And so he was the one who filmed or shot our interviews, and we got a little additional, B-roll as we call it. And then after that, I wrote the script, and then he edited it for me, and he created all the graphics for it. And it was kind of a team effort of just doing research and finding old photos and finding old film and getting permission, which I think anybody can just use if they're resourceful, you can do that research and you can find those images, and anyone can go out and hire a production crew. And there's, a range of, for whatever budget you have, I think you can find somebody to really meet your needs and do the shooting and doing the editing and helping you with the visuals.
Yeah, I think a couple of things there might be surprising for people that have never made a film before is that you were able to do this yourself, a colleague, and one camera person. So a crew of three essentially did this film. And then the other thing you just said was after shooting, you wrote the script. And I think a lot of people that are new to documentary don't necessarily realize you think of the script in a feature film as the first step. And in documentary, you might not know what your story is until you've done your interviews. So you're actually scripting after the fact. Is that?
Yes, that's absolutely right, and that's the way I was trained as a journalist. You know, we don't decide the story; we go out and get the story, and we may decide on the elements we need. You know, I need a doctor. I need a doctor who disagrees with whatever that doctor you know, whatever his new treatment is. You know, to provide balance. And then you go and you want to find somebody who's affected by the treatment, whether it's a surgery, a drug, or something else. So you go out and find that, and then you have to kind of pre-plan that you're going to get the visuals, because the one difference with a television story or even a film is you need to be able to tell that story with pictures, and that's often the biggest challenge, is gathering those elements. So when I came back, I did review all of the footage and then told the story with the sound bites, the sound that I had. And then I filled it in with my narration to kind of try to explain some of the more technical features, or provide a backdrop where we could use graphic images to help tell the story in a very clear way. And I understand that there are plenty of those who just string together their sound, and that's a very powerful way of storytelling as well, as you know, where you don't necessarily need a reporter narration. But that's kind of, once again, where my training background came in. That's the way I approach stories.
Yeah. And can you just tell us how long it took shooting and how long post-production took for your film?
That was kind of a longer process, because we had the time difference, of course, and he would send me video, and then I would look at it and I would write up edits and I would send it back to him. And then he was juggling my project with other projects. I have to say the editing process probably took several months. And then he was also building graphics for me during that time. But a question as far as how long it took to actually shoot it, that was just 2 days of shooting in the United Kingdom. We had 1 day of shooting in Cambridge, and then a second day of shooting in London, where we followed our patient, Shirley, who was one of the first people that Dr. Walsh ever treated back in the 1950s, which was another amazing discovery, to find this patient who was treated as a teenager, and now she just celebrated her 80th birthday, and she is still living a full life because of this first drug discovery.
She's certainly a great character to have in your story. It really puts not just a face to it, but a lifespan to the history of this disease, which is really the point of your film.
You know, Dr. Wilson called it the Great Masquerader, because it can manifest as a liver disease, it can manifest as a psychological disease, it can manifest as a neurological disease, or a combination of all three of them. And that's because the copper can deposit, as I had mentioned, first in the liver and then in the brain. So it could be in the frontal lobe, and that's what causes these psychiatric symptoms, or in the basal ganglia, which can cause the neurological symptoms. And that's the challenge of diagnosing this disease, and why we're so interested in increasing awareness, because the good news is, for Wilson disease, we have 3 treatments. And as you know, Daniel, most rare diseases don't even have a single treatment. So just the fact that doctors and other health professionals can just think to consider Wilson disease can go such a long way in diagnosing people, and diagnosing them before they have some of these symptoms that in some cases are not reversible. There are people who cannot reverse their neurological symptoms. There are people where with their liver failure, the drugs just cannot help them. It cannot save their liver, and they have to get a liver transplant.
Thank you, Rhonda, for coming on and for sharing all this information. And of course, your film is available on our channel, and people should look for the story of Wilson disease and watch that if they haven't already. And I'll look forward to the days when we can see each other in person again.
Absolutely. And Daniel, thank you so much for this opportunity. This rare disease channel, the film festival, is just such an excellent opportunity to educate people about these rare diseases.
Well, thank you.